Hi, okay. So I just wanted to explain what I'm going to do before I actually get into it. So I have a script and it's patient and nurse. So I'm going to be the nurse, clearly. And I'm going to just go through it as is my patient is in the hospital and I'm the nurse in charge. And I'm going to go through like the doctor's orders and patient teaching with the patient and the patient's diagnosis. So I'm just going to explain everything as if the patient was in front of me. So I'm going to be talking to the wall. So I just wanted to explain before I actually got into it. All right, I'm going to start. Hi, Mr. Smith. My name is Shay. I'm going to be your LPN in charge today. So I'm just going to start off by getting some vital signs and just let me know if you have any questions, okay? All right, so I'm going to get started. Okay. So looks like your blood pressure is 138/84. Your pulse is 94%. Your temperature is 101.5. And your respirations is 20. How are you feeling at the moment? Okay, so you have a headache. Okay, well, let me just take a look at your orders, and then I'll go and give you some medication, okay? So I'm going to be right back. Okay, Mr. Smith, so it looks like that your doctor has put in an order for Tylenol, so that should help with your fever as well as your headache. So here's some water for you to go ahead and take. All right, Mr. Smith, how are you feeling after your Tylenol? You're still not feeling the best? Okay. So it looks like your x-ray results came back and your blood work results came back. Your x-ray results did show bilateral pneumonia. So you have pneumonia in both of your lungs. Your Dr. Romby wants me to start you on antibiotics right away. And then we also have some medication to help with your cough. So that way, that's probably where a lot of your chest pain is coming from, where you're coughing a lot. That's one of the complications with pneumonia. So while I'm getting the medications, I'm just going to go over pneumonia. Have you ever had that? All right, so pneumonia can range in seriousness from mild to life-threatening. It's most serious in infants and young children and people over the age of 65, and for the people who already has a weakened immune system. So if you have heart disease, if you have like lupus, something that weakens your HIV, it's going to affect those patients the most. It's an infection that inflames the air sacs in both lungs. Their air sacs may be filled with fluid or pus, causing coughing, with phlegm, fever, and chills, and difficulty breathing. A variety of organisms, including bacteria, virus, and fungi, can cause pneumonia. So many germs can cause pneumonia. The most common are bacteria and viruses in the air that we breathe. Your body usually prevents you from those germs infecting your lungs, but some of the time those germs can overpower your immune system, even if you're pretty healthy in general. So community acquired pneumonia is one of the most common types of pneumonia that patients often get. It's also known as the walking pneumonia. This type of pneumonia occurs like outside of the hospitals or at other healthcare facilities. It could be caused by bacteria-like organisms, fungi, viruses. Viruses like the COVID-19 that's going on can develop into pneumonia. If you've had a cold recently, it can become severe. Being hospitalized puts you at great risk for getting pneumonia. If you're in the ICU and you've been on a ventilator, if you have a chronic disease, that's going to also boost your risk factor for pneumonia. So COPD or heart disease. Smoking is also a risk factor. It damages your body's natural defense against bacteria, viruses that causes pneumonia. And then, of course, the weakened immune system, people who have HIV or who's had a organ transplant or is receiving chemotherapy, long-term or long-term steroids at risk. So, one of the main complications is difficulty breathing. If pneumonia is severe or if it's chronic underlying lung disease, you may have trouble breathing and getting enough oxygen. So most patients will probably be put on oxygen through the nasal cannula. The signs and symptoms of pneumonia vary from mild to severe, depending on the factor or the types of germs causing the infection, and also the age and overall health of the patient will determine how severe the pneumonia can get. One of the most common signs and symptoms is chest pain when you breathe or cough, confusion, cough, fever, chills, sweating, shortness of breath, nausea, and vomiting, and also a headache. So treatment for pneumonia kind of varies depending on the infection and the complications that the patient has from pneumonia. Most people can be treated at home with just rest and fluids. Other people may have to be hospitalized especially if they're having problems breathing. So they'll have to be in a hospital and probably put on the ventilator. And some of them can go into ICU. Most of the symptoms will ease in a week or a couple of days. But the tiredness and just overall feeling of not feeling good can last for much longer. And some of them, the cough can last for months. Specific treatments just depend on the types and severity of pneumonia and your age. So it can range from antibiotics and then you can probably have cough medicine for your cough, fever reducers and pain relievers. And then tips to help you recover would be to get plenty of rest. Don't go back to work or school within the first week of having pneumonia. You're going to need to actually stay on bed rest for a while just to give your body time to heal. You want to stay dehydrated. Make sure you're drinking plenty of fluids a day. So the CDC recommends 8 ounces of water a day. So you're going to make sure you want to try and follow that, or just based on your body weight, to be honest. And then you want to make sure that you take your medications as prescribed. So if you're getting an antibiotics, make sure that you finish it all, because you do not want that infection to develop again if you don't finish it all. So even if you start to feel better, you have to make sure that you take your antibiotics. All right, so I'm going to pause and just let me know if you have any more questions. And I'm going to go look at your orders again, okay? So pneumonia is very common. It affects about 450 million people in the world, so that's a lot. So the pathology for pneumonia is, so you have your alveolar sacs that is in your lungs. So when you have pneumonia, your air sacs gets filled with infection and white blood cells and like mucus and pus, and this clogs up your air sac. So your air sacs is where your gas exchange comes. So when you're trying to breathe in that fresh oxygen, it can't get through all of the mucus and everything. So you can't. Sorry. So the red blood cells doesn't get that fresh oxygen. So therefore you develop pneumonia. So once you develop pneumonia, that's when your signs and symptoms come in. So that's when the most common three ones that's going to come in is when you have a fever. So we're going to check your temperature. Your temperature is going to be elevated. Anything over 100.4 is considered a fever. And then you're going to have your lungs is going to show infiltrate on your chest x-ray. And your white blood cell count is going to be elevated when we do a complete blood count for your lab work. So after the 3 most common signs and symptoms show up, that's when you're going to start seeing a lot more. So it kind of varies from the young patients to the older population patients. So the young patients are going to have more of the respiratory symptoms. So they're going to have the shortness of breath, the cough, which is going to probably make their chest hurt. So the cough, shortness of breath, more of the respiratory problems. And then the older patient, they might not have any of those. They might just be confused and really sleepy and not really knowing, not acting like themselves. So it's kind of, the signs and symptoms can definitely be different from the young population to the old population. So there's going to be two types of different pneumonia. So there's going to be a community acquired pneumonia, and then there's going to be healthcare acquired pneumonia. So the community acquired pneumonia, it's going to be if the patients are coming just from like their house, their apartment, anywhere that's basically not inside of the hospital. So the healthcare pneumonia is going to be if the patient, let's say the patient was in the hospital for 48 to 72 hours and then they develop pneumonia, that's going to be the healthcare acquired pneumonia. Or if they're coming from a nursing home and they get pneumonia, that's gonna be considered healthcare acquired pneumonia. So a lot of common questions are, is pneumonia contagious? So pneumonia can be contagious. It's spread through airborne. So let's say someone who with pneumonia, if they touch or they sneeze and they don't cover their mouth, they cough, they don't cover their mouth, it's now in the air. So if you walk through that pathway where the person's coughed or sneezed and you're inhaling that, then that's one of the ways that you can get pneumonia, because the bacteria. So pneumonia is both viral and bacterial, so that is how it's contagious. And it just spreads from person to person. So that's one of the types of ways that you can get pneumonia as well. So the doctor may prescribe a medication to treat the pneumonia. So he can prescribe an antibiotic. The antibiotic is only going to treat the bacteria pneumonia. So if you have a viral pneumonia, it won't help it. Sometimes the doctors will prescribe an antiviral to help treat that type of pneumonia, but most of the times those types of pneumonia can just be treated at home with resting fluids. If they do, however, prescribe the antibiotic, then you want to just make sure to tell the patient to always continue the prescription even if they're feeling better, because we don't want a risk of the pneumonia coming back. So, and then also the doctor can prescribe an antifungal medication if the pneumonia is caused by fungal. So that's more the less common one. The viral and bacteria is the two most common ones. So the doctor may also recommend over-the-counter medications. So aspirin, acetaminophen, ibuprofen, a lot of those medications are going to be good for fever reducers or pain relievers. And then also he may prescribe a cough medicine. So we just want to make sure that we tell the patients that when the doctor recommends a cough medicine, it takes the fluids from your lungs. So we want to make sure that they stay hydrated, because you do need fluids. So that way, because fluids and rest is part of the treatment plan as well, drinking plenty of fluids. So but aspirin, acetaminophen, and ibuprofen are going to be the three main over-the-counter medicines, as long as with those cough medicines to treat pneumonia. Okay, so pneumonia prevention, it kind of goes along with the risk factors. So you just want to make sure that if you're a smoker, that you conscience the patient about smoking cessation, so that way they can try and stop, because that does consider them a high risk factor for pneumonia. Some of the ones you can't control, like age, your weakened immune system, those patients, you just want to encourage to get the pneumonia vaccine. So there's Prevnar 13. It's one of the most common ones to get. And then also to get like a flu vaccine and a HIV vaccine. So that way they won't get sick and then put them in that risk factor for getting or developing pneumonia. So more on the prevention. So again, the smoking, you just want to make sure, try to encourage them to stop smoking. Smoking just puts you more at a susceptible for risk for respiratory infections, especially pneumonia. You want to make sure that they're washing their hands every day with soap and water. Encouraging a healthy lifestyle, so eating healthy, exercising regularly, sleeping a good amount of sleep every night. You want to make sure that they cover their mouth when they cough or sneeze, and then properly disposing of those tissues. So all of that with getting the vaccine is really going to help them with not getting pneumonia or trying to be out of that risk factor for getting pneumonia.